Respiratory problems are not exclusive to humans. Dogs and cats can also experience breathing problems. When should you be concerned that your pet is not breathing well? We'll talk about common respiratory problems and some treatment options on this episode of The Paw Report. Stay with us.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Welcome back to this episode of The Paw Report. I'm your host, Kelly Goodwin, and joining us today, a first-time guest of The Paw Report, Dr. Joe Bruner, here at the University of Illinois Veterinary Teaching Hospital. The first question is always the easiest, Dr. Bruner. New guest, you got to introduce yourself to the viewers and tell us about your background in veterinary medicine.
Oh, certainly. So I graduated from Ohio State University back in a long time ago, 1992. But so I was in private practice initially. Didn't really think I wanted to be a specialist or to do this field of medicine, but started in private practice and just found that I wanted more. I wanted something different, wanted to expand my understanding and knowledge of things. So I went back and did my advanced training and internship and a residency, and then started in private practice. So I had a career, I would say a career, or a nice time for 27 years in private practice, doing specialty medicine and internal medicine, and then reached a point where I'm like, I'm ready to move up. I'm ready to move to something more challenging, ready to move into something that I can dedicate more of my interest in, my individual discipline, my individual interest of pulmonary medicine or respiratory medicine. So I joined the University of Illinois as one of their assistant professor faculty members in internal medicine.
Can you also, I don't know if the cameras can see her just yet, but we also have another little guest that's going to be joining us throughout the interview. Who'd you bring along from your family?
We brought Emmy. So Emmy is one of our French bulldogs, and she's a perfect example of things that the public needs to be aware of in terms of respiratory issues in dogs. And then we'll briefly mention about cats as well.
Yeah, so what are some of the common respiratory problems that dogs encounter, you encounter with some of your clients that come in?
Sure. Well, I think there's an important distinction between dogs and cats. You know, when we're dealing with respiratory disease involving the lower respiratory tract, which we'll talk about in a moment, the difference between the upper and the lower. So the lower respiratory tract, we're dealing with basically the trachea and the lungs. And in dogs, it is infections, infectious, whether that's viral infections, whether that's bacterial disease, whether that, especially in Illinois, where we geographically have an endemic problem of a fungal infection that gets into lungs called blastomycosis. But in dogs, infectious. That's the recurring theme. Now, in cats, it's slightly different. Cats, in the lower respiratory tract, we're dealing with inflammatory diseases. And the most prevalent inflammatory disease is asthma. Just regular young childhood asthma. Cats are a very close model of asthma that occurs in young children as well. So asthma or inflammatory lung diseases are the common problems in cats.
Can dogs get or have, whatever the proper terminology is, COPD, like people have?
Sure. So in people, COPD, which is chronic obstructive pulmonary disease, COPD and emphysema and pulmonary fibrosis, these are very common catchphrases or catch diseases in people, but they're often linked to cigarette smoke. Okay? And individuals either secondhand smoke or active primary cigarette smoking, which for my patients, the lack of a prehensile thumb pretty much tells me they're not getting into cigarettes.
Right.
So we really don't run into emphysema and COPD and those whole varieties of obstructive lung diseases like what they see in people because our veterinary patients are a different population. Now, it doesn't mean they can't get it. In some dogs with very advanced stages of bronchitis or other bronchopulmonary diseases, so bronchitis being the airway, pulmonary being the lung. In the very advanced cases, it can mimic or look like COPD, although it's not an exact match.
What about pneumonia or kennel cough or distemper?
Yeah, so that's the dog problem, right?
Dog
So we're dealing with infectious diseases, and so kennel cough is a very good example of a community-acquired infectious disease, because kennel cough is effectively a virus and a bacteria. So we have a virus that gets into the lungs, and then a bacteria, Bordetella, sets up the opportunity, and those two, 1 + 1 = 5. So 1 + 1 = kennel cough. Now, the majority of time for kennel cough, those dogs are they've had exposure to a kennel, hence the name, or they were in a boarding facility, or they went to doggy daycare, or they went to the dog park, so they were around other dogs, they picked up the virus, the Bordetella took the opportunity, and now your dog is coughing. And it is significant. They are actively, they are coughing, and it is a dry, honking cough. Okay, and it sounds horrible, but they're not dying. They're just all their airways are very irritated and inflamed, and they have this virus. And with proper supportive care and cough suppressants, the vast majority of dogs with kennel cough can get over the infection, and they do fine. Okay, a small percentage of them can then take kennel cough and then develop into pneumonia. And that's where it becomes a more serious problem. Because now that Bordetella took the opportunity, it said, woohoo, I can move on down the line and go into the lung tissue, and now you got lobar or bacterial pneumonia. And that's probably our second most common thing we see here at University of Illinois is bacterial pneumonias that are either preemptively from a viral infection or from what we call aspiration pneumonia, where a sick patient, sick dog, vomits or has some reflux of material, and then they get it into their lungs and they get pneumonia. So the third is our fungals. So blastomycosis is a fungus that's endemic to Illinois, and we see it quite frequently here. Now, when the fungus gets into the lungs, now we have a much more serious problem. We have lots of antibiotics. We have good choices to treat that. Kennel cough is often self-limiting, but that blastomycosis, it requires care. And many times it requires to be hospitalized and get very intensive therapy. Even with the best of care, some patients pass away from that. So it's a serious thing. So when dogs present with pulmonary disease, cough tends to be the most common thing. Dogs cough, okay? And you may notice initially that they're breathing a little bit more heavier, or that they seemed like where they used to go jogging for 5 miles and now they only make it out 1 mile and they seem to be having problems. So exercise intolerance, those are more subtle things, but cough is the major symptom. If we see cough in dogs, that's a problem. Okay? Cats are more subtle. They don't like showing you that they're sick. Okay? So cats will hide their lung problems. They'll hide their respiratory disease, and until they can't hide it anymore. So some cats will cough, that's obvious, but some cats will just be they'll be quiet, they'll be reclusive, they just don't want to interact with you very much, and you notice that they're breathing a little bit faster, but if they ever get to the point where they open their mouth and they're panting, okay, in a cat, or if they're coughing and can't catch their breath, that's a sign of I have a lung problem or a pulmonary, and that's distress, right? Now dogs pant. We know dogs pant, okay? So we can't use panting as a sign in dogs, but if a cat ever is opening its mouth and panting, that's an emergency. Okay? So cats are inflammatory, asthma, allergic inhalant disease. We don't want to call it really allergy. We want to call it that they have reactive airway disease. That's the new terms for that. So, but particulate, poor air quality, allergens in the environment can all trigger asthma and asthma-like conditions in cats. And that's probably the most common thing we see in that population.
Let's go back to the upper tract and the lower tract.
Well,
You
sure.
said there is quite a difference in that.
Absolutely, because we lump the respiratory disease. So my field of interest or my discipline is pulmonary disease or respiratory medicine. And in people, they divide the respiratory tract into 2 areas. So the respiratory tract officially starts in your nose, okay, in the nose of the dog or cat. And then the nasal passages, the sinuses, all go back into the nasopharynx, which is the communication of your nose into your lungs. The nasopharynx then goes past your voice box, your larynx, and down the trachea into the lungs. That entire thing is the respiratory tract. So in people, everything from your voice box up is seen by your ENT, your ear, nose, throat doctor, okay? And anything from the voice box down, you see your pulmonologist, okay? Well, in veterinary medicine, that's all put together. We lump it together, and individuals that are small animal internists, like myself, with special disciplines in respiratory medicine, we see those patients. So the upper respiratory tract are things that your ENT doctor would see, okay? So that is your voice box, the back of your throat, all the way through your sinuses, your nose, up to your nose. That is the upper respiratory tract. So the voice box down into the lungs is the lower respiratory tract. And we make a distinction because diseases of the lower respiratory tract are not the same as the diseases of the upper respiratory tract. So we have to, as veterinarians, make that division and know that we have a whole new problem if a dog presents with nasal discharge, if it has a runny nose, or if it has thick, green, snotty nose, okay? Those diseases that cause that are very different than the diseases that cause cough or lower airway disease.
Would you say seasons play any factor in the cases that you see? We're filming here in July, hot, muggy, but you know, in Illinois, we do get all 4 seasons. Does that play into respiratory, pulmonary problems?
It does in 2 ways. For cats, it can play a factor because cats who are asthma candidates, you know, lower reactive airway individuals. So air quality and the different forms of allergens in the environment can be triggers for their asthma and bronchial disease. But in dogs, it's mostly the concern about being in confined spaces. So in the winter, we tend to be confined more.
Yeah.
We're not outdoors as
Right.
much. We're not out running and doing things. So for that exposure risk, that is a concern. But really, seasonality for dogs is not much of a concern as it is sometimes for cats.
Let's talk about breeds. One of the reasons why you brought one of your Frenchies today, there are certain breeds that can be predisposed, if you will, to respiratory problems.
Yeah.
Let's. Oh, she's over at the door, but she'll come. Come here, Emmy.
Well, this is a perfect example. So what I brought is Emmy. Okay, so Emmy, who is a diehard Illini with her collar.
She is.
Emmy is, for the past 3 years, the American Kennel Club has announced that the French Bulldog, who Emmy is a candidate, so the French Bulldog is the #1 popular breed in the United States, followed by the Golden Retriever and then the Labrador Retriever. But why I brought Emmy is she is a primary example of a breed-related respiratory disease. So she is very different than a Golden Retriever, okay? And mostly about her head shape and her lungs. So she has a reduction in her nose, so she is a brachiocephalic, smooshed-in face dog, okay? And that changes how she can breathe through her nose, how she can breathe and move air past her voice box and her palate. And we have found more and more that dogs like the French Bulldog are predisposed to certain tracheal and lung diseases, all related to their conformation or their appearance. So we do recognize there are many different breeds of dogs that are predisposed to different types of respiratory disease, but these guys, best little dogs in the world. She is truly my gumdrop from heaven. I love her to death, but it's when you get a French Bulldog, you need to be aware that when you get one of these dogs, they come with luggage, they come with baggage, you know, and you need to be prepared for the idea that they'll need veterinary care throughout their life. And some dogs who are more severely affected by brachiocephalic airway disease, that they may require corrections or surgeries to help them breathe.
Can we talk about that a little bit more? Because that kind of led into my next question about treatments, treatment options. I'm sure they vary by the patient, but can you talk about some of the things you go over with clients that come in with their pets?
Yeah, so we remember that for dogs, putting the breeds aside, the most common things we deal with are infectious, right? So we have wonderful, with the advent of antibiotics and with the use of bronchodilators and other anti-inflammatories, even inhalers, with this new armamentarium of drugs that we have in veterinary medicine, we have a lot of good options in treating patients with lung disease, and especially infectious lung diseases with antifungals, antimicrobials, and antivirals. Now, most of the time in dogs, we don't have to go to the antivirals yet, but influenza and other forms of viral disease, we have that option in the more severe patient that we can utilize those medications successfully to treat many forms of lung disease. Now, for brachiocephalics, for example, yes, sometimes we need a surgical intervention. And one of our surgeons, Dr. Heidi Phillips, has revolutionized much of the reconstructive surgeries and are very effective surgeries for these brachiocephalic dogs. So we're doing very good things here at the University of Illinois for being proactive for the treatment of these dogs, since they are becoming so popular.
Maybe a strange question, but can fleas play any, I mean, if it all goes back to being viral, and fleas may carry that, I suppose that they could be the culprit for some problems?
Yeah, we don't really recognize that many diseases where fleas, which can carry disease by all accounts, fleas and ticks, but we really don't attribute fleas as a source for respiratory diseases in dogs and cats. Okay, now, they are still something to be very proactive. We want to do flea prevention, both for skin problems as well as in cats that they can carry certain blood parasites. So we want to be proactive for that. But when it comes to fleas as a source for lung issues, both in dogs and cats, we don't really see that very often, or there's not much of a connection there. Now, other infectious diseases, of course, and always we go back to viruses in dogs, bacterial pneumonias, blasto or fungal pneumonias. Those are our villains when we're dealing with the dogs. And there are still others. Dogs can get chronic bronchitis, especially in larger breeds. So golden retrievers and Labradors and German Shepherds that are older, if they have a chronic or recurring cough, they can have bronchitis. That's not infectious. They just have a chronic inflammatory bronchitis. So we can see other diseases as well. But we've really, in veterinary medicine, our ability to treat these diseases have really grown exponentially. And what it used to be, in some cases, for distemper and other more serious viral infections, what used to be a death sentence, now we have a lot of good options to treat them long term, and they can live very good lives knowing that they have concerns.
Let's circle back around as we have a few minutes left in our discussion. Let's hit on the pet owners. So let's recap some of the maybe visual signs that they see that they should take note of, and that's when they need to call the vet. And then maybe a memorable client or story that you can share with our viewers of maybe somebody that came into your office that was very clearly, you were like one of those oh no moments, and that's a wonderful ending.
That's very good. So I think the best message for our viewing audience is that preventive health care goes a long way, okay? And keeping your dog and your cat, doing an annual visit with your veterinarian and keeping them up to date with vaccinations is very important. And even if for dogs, for example, and in cats, some of the respiratory viruses like herpes virus for cats or parainfluenza and influenza in dogs is very treatable, very preventable with proper vaccination protocols. So really encourage, stay up to date, see your veterinarian on an annual basis. What you want to watch for in dogs, it's coughing. Remember, cough, 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 or just getting winded or having labored breathing when they exert themselves. That's their signs. In cats, it's subtle, and you're going to, yes, watch for cough, but cats, it's all about, are they eating? Are they being reclusive? Are they having a quick or rapid respiratory rate? So if you see their chest going back and forth, even if their mouth is closed and they're looking at you, if they're breathing fast, that can be an early indicator, okay? So those are preemptively things that we want to do, okay? And then you had a follow-up question.
A story.
story.
Client.
Well,
maybe it's one
truly-
of your Frenchies, or maybe in your years of private practice, you remember a specific animal that came in.
I clearly do. So, and this is one of those cases of really was a defining moment that led me down the path of respiratory disease as a, there's many small internists that are available at universities and tertiary care facilities, but there's not many of us who are field specialized in respiratory medicine. So, and I'm one of the internists here, I'm one of the few that has a focus on respiratory medicine. So, very early in my career, I had a dog named Lucky. Of course, they're always named Lucky, but a dog that named Lucky who presented to me with pneumonia, and it was a pretty significant pneumonia. And I even got cultures and grew 2 very unfortunate bacteria out of the lungs, and this was a very affected dog. And there were many times through the course of his hospitalization I just sat there. I'm like, Lucky, I hope you're going to make it. And you see them, and you're like, you see indicators of like, oh my gosh, oh my God. But the owners just saying, as long as he's there and as long as he's with us, we're willing to keep going. And it took a while, but Lucky rallied and he pulled out of it. And after 10 days of hospitalized and IV antibiotics, he made a recovery. And it was a defining moment for me because I mentally at one point thought, oh, Lucky, you're not going to make it, and I didn't really give up on him, but I realized, okay, you're very sick, but the owners absolutely wouldn't give up on him, and so I think it made a difference because it really reinforced that we can do good things and we can take patients who are pretty severely sick and make a difference for them. And I still get a Christmas card from them every year.
Aww.
So it's just a wonderful, it really made an impression upon me, and it really came down to that dogs and cats can get sick, but we have options and they can live very good lives. We just have to be on top of it.
Luck was on Lucky's side.
Luck is on Lucky's side.
Dr. Joseph Bruner, thank you so much for the time you spent today with the Paw Report and bringing your special friend. She was so sweet today.
We were happy to be here, and thank you for inviting us.
Well, you are so welcome. And again, thank you for joining the Paw Report. Our time is up for this episode of the Paw Report. Until next time, I'm your host, Kelly Goodwin.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.